Welcome to Angeles Institute Sims Lab. My name is Anna and I'll be demonstrating the procedure of inserting a nasogastric tube. This is done as an aseptic technique, which is also known as a clean technique. You want to check your patient's history for any loss of the gag reflex. Check if your patient has a deviated septum, has any nasal surgery or unusual bleeding. Also, you have to check if your patient's allergic to latex. Let's gather our supplies. You'll need a towel, a kidney basin, a cup with water, a straw, a pen light, tape, lubricant, alcohol swabs, an empty syringe, a stethoscope, and an NG tube. Depending on the doctor's order, you might use a size 14 to 16 French tube. For suction, you might use a size 18 French tube. Let's get started. First, you have to wash your hands and don on clean gloves. Explain the procedure to the client. Hi, my name is Anna and I'll be your nurse today. I have a doctor's order to insert a nasogastric tube that will start from your nose to your stomach. Could I see your wristband, please? You have to sit your client up in a high Fowler's position. You have to cover the chest with a towel. With the pen light, you will have to check the patency of each nostril. Also, have your client blow one nostril at a time. You will need 3 pieces of tape, making sure one is at least 4 inches and is split in the middle. Next, you need to measure the NG tube. This is done by placing the tip of the tube to the nose, to the earlobe, and finally to the xiphoid process. Before inserting the tube, you have to make sure you lubricate at least 4 inches. Ask the client to tilt their head back and gently insert the NG tube. Once I insert the tube, you're gonna feel like you need a cough. Once you do, I'm gonna go ahead and tilt your head back and give you small sips of water. Make sure not to let go of the NG tube because it may slip out. Apply tape on the bridge of the nose and wrap it around the tube. Check for placement by inserting 30 cc's of air, and with the stethoscope, listen for a swoosh. This will be heard on the left upper quadrant of the stomach. Auscultate and aspirate gastric content and put it back. Clamp the NG tube and secure to your patient. Place the last piece of tape to secure the rest. Position the patient comfortably, collar within reach, both side rails up, bed in lowest position, and bedside table within reach. Thanks for watching Angeles Institute Sims Lab. Until next time.